At the Breast Health Center of Excellence at Memorial, we take a multidisciplinary approach to care, matching the best doctors in the area with cutting-edge technology and using national guidelines to provide the best care possible to every woman we treat. Our team understands every woman is different, so compassion is an invaluable part of the treatment plan.
Here in the Breast Health Center, you know that every woman that's walking in is walking in for the same reason. It also helps facilitate with the flow of things. When you come in for a screening mammogram, it's nice to come into the same place where you'll come if you end up having a callback and needing a diagnostic mammogram. Therefore, then you could continue, see the surgeon or the radiologist, and then have a biopsy here and have it all kind of in one place.
The Breast Health Center was created to provide women breast care in a more private, caring environment. And we wanted to give patients a high-quality option for care that is close to home. Kim discusses the center's goals.
I would say to give compassionate and coordination of care when going through this. Certainly, even if their diagnosis doesn't end up being breast cancer, it's scary enough just needing a biopsy. So it's very highly emotionally charged, this center is, as far as we really cater to calm down, we're here for you, it's going to be okay.
Kathy Sweeney, a breast cancer survivor, agrees.
They're caring. I think they feel like maybe they're like your family. Some have been through it themselves, so they know what it's like.
At the Breast Health Center, the coordinator and breast health navigator are usually the first people a patient will see after an abnormal mammogram.
I'm the breast center coordinator, so I'll call the patients and let them know that they've had an abnormal. I book the appointments for them to get them back in, as well as the navigator does too.
My main role in the Breast Health Center at Memorial is to navigate a patient that has screening mammogram that has become back abnormal to a diagnostic mammogram, and if that is still abnormal, then we navigate them to a breast surgeon or one of our radiologists to do breast biopsy.
The Breast Health Center offers 3D mammography. This innovative technology allows our team to view the breast in 3D slices, like the pages of a book. 3D mammography not only reduces the need for follow-up imaging by 40%, it also finds invasive cancers sooner. If the screening mammogram does come back abnormal, Kim or April will give the patient a call.
Well, as I'm calling them back for their diagnostic mammogram, I try to tell them that most of the time it turns out to be nothing, but we have to prove that there is nothing going on there, and then if it happens to be something, and they come to me after all their imaging, that I tell them that 80% of biopsies turn out negative.
Susan Harris received a screening mammogram at a Healthy Direction event. It showed an abnormality. After her diagnostic mammogram, she got a call from the navigator.
I had to make an appointment with a surgeon, and I went through Dr. Barnett here at Memorial, and we did a biopsy here in the breast center, and then a week later was with my appointment with him, and then that's when I was diagnosed. I was told that I did have breast cancer.
Dr. James Clanahee is the Breast Health Center's medical director.
What we've found through the years, and particularly as we become more dedicated to the process, is that when a woman is sent to my office with an abnormal mammogram or abnormal ultrasound needing a biopsy, she obviously is concerned. If she does have cancer, by the time that she comes to the office to see me, and it's usually very quickly after the diagnosis, that will be the fourth time that I've actually interacted with her, and I've been able to construct a bond with her and hopefully build trust.
Following an abnormal biopsy, the surgeon will often speak to both the medical and radiation oncologist. The Breast Health Center has created a Tumor Conference, a bi-weekly meeting bringing together surgeons, radiation oncologists, medical oncologists, radiologists, and pathologists. Here, they are able to truly collaborate on how to provide the best care possible for each patient.
At the Tumor Conferences, the physicians all give their opinion as to what should be done. And luckily, there are a lot of studies that have been performed with breast cancer, so there's national guidelines that we follow to just do what we're supposed to be doing and are the trends of what works very well.
Medical oncologist Dr. William Popovic explains how chemotherapy drugs have advanced in the last 35 years.
From 1980 to 1990, we had one new medication in 10 years. One. In 10 years. We all receive about at least one, sometimes 3 or 4 new medications per month now. So that's changed dramatically. So what we can do, what we can offer women has been transforming in that time.
After gathering everyone's input on the case, the surgeon will meet individually with the patient to explain the next steps and offer emotional support. For patients who need radiation therapy, Dr. Ledezinski explains her process of working with her patients.
So at the time of consultation, we go through the typical history and physical exam, and I explain to them about their cancer.
They take you step by step. No matter how many times I called with questions, they were always willing to answer, whether it be the doctor or even just the nurses or the receptionist.
Their CAT scan goes through a planning process of dosimetrists and physicists and checkers and double checkers, and then they finally let me check the plans. But it takes a full week to process that plan. So I explain that process to the patient so that they understand why they have to wait so long before they can get started with the radiation. And then as they go through the treatment, I see them weekly just to see how the treatments are going for them and let them know what to anticipate over the next week.
Throughout the process of being diagnosed and treated for breast cancer, patients have many questions and concerns. From the mammogram,
I think there's 2 main fears. One, that it's going to be painful. And 2, are we going to find something? And granted, there's pressure, but it's only momentary. And I just tell them, it is only momentary and it could save your life someday.
to radiation therapy.
Do I really need to do radiation therapy? How are you not going to hurt me with radiation? There's a lot of fear out there about radiation treatments. So I explain the process of what we do and how we shield normal tissues and focus on treating what needs to get treated. So if patients ask for statistics, I give them statistics, but usually patients just want reassurance that they're going to be okay.
No matter what the question, the Breast Health Center team will find the answer and keep supporting you when your treatment is complete. One way we help breast cancer patients is through Hope Blooms, a support group for community members who have been diagnosed with breast cancer. Each meeting has a speaker, and topics range from new technology to advancements in research. After the speaker, the members of the group can share their personal stories. Support is an important aspect to a breast cancer diagnosis. The Breast Health Center of Excellence offers support alongside amazing physicians, surgeons, nurses, techs, and support staff. When you consider they're also using the most innovative treatment plans and technology, they are the people you want on your team when it comes to fighting breast cancer. It is a frightening disease, but the Breast Health Center uses national standardized guidelines and multidisciplinary treatment to provide individualized care close to home. And thanks to advancements in medicine and technology, 85% of patients diagnosed with breast cancer are still alive 15 years later. The Breast Health Center offers more than treatment. We offer hope.